diabetes? Everybody thinks about diabetes as a high blood sugar problem. And yes, it is diagnosed as a high blood sugar problem. All right. And many of you may know this either directly or through somebody in your life who has diabetes. And maybe this was your experience that you get diagnosed, you start on one drug, the drugs go up, and after keep going back to the doctor, it starts to become multiple drug combinations, and then finally the picture starts to look like you're avoiding the mangoes, you're avoiding the sweets, you've stopped eating sugar, and still your diabetes is progressing, and then now they're beginning to talk about putting you on insulin. All the while you might be still gaining weight even though you're following some sort of diabetic diet. And one of the questions that came was, why do we crave sweet? And one of the reasons that you will crave sweet is because of the treatments that we give you, which is we prescribe drugs to push the high sugar down, but we push it down so hard. We doctors' prescriptions are so strong sometimes that you get a low sugar. And diabetes was high sugar. We made it a problem of low sugar, and then you have to keep eating to keep your sugar high. So it's a situation where a patient can get stuck. And my role is to help you break out of this sort of upward spiral where eventually they're talking about just getting on insulin. Diabetes, before it becomes a blood sugar problem, is an insulin problem. The same way malaria is not a problem of fever. Fever is a symptom of malaria, but malaria is an infection by a malarial parasite because a mosquito bit you. Dengue is as a viral infection because a mosquito with dengue parasite bit you. So what is insulin? Insulin is the hormone that regulates your blood sugar. Insulin plays many, many roles in the body. There are two kinds of patients. One is somebody whose body is not making insulin. Type 1 diabetes, juvenile diabetes, insulin dependent diabetes. Growing inches around the waist, that's type 2 diabetes. This type of diabetes does not require insulin as a treatment. Okay, how will you know whether you need insulin as the treatment or not? How will you know if your pancreas is working or not? This blood test at the top, fasting C-peptide, and you can do, if you're not being given insulin injections, then you can do an insulin test. If you're taking insulin injections, do not do the insulin test. Okay, then only do the fasting C-peptide test. That will tell us whether we should be treating you with insulin or not. Because if your pancreas has not failed, the treatment should not be insulin. If you're making insulin, I should not give you insulin. I should give you lifestyle change. So what are the lifestyle changes that we work on, which have been impressively powerful with our patients? How do we get them to less medicine and less insulin? In brief, nutrition, going low on carbohydrates, sleep, stress, exercise. Do we have to stop sugar completely? And the answer is, I've seen people stop sugar ever since they found out about diabetes, but they keep all the other carbohydrates in their life and the diabetes never gets cured. So when the chai comes, they'll say, nahi, 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 mujhe sugar hai, diabetes hai, so give me fika chai. But then they'll have 3 chapatis. They'll have poha for breakfast. They'll have biscuit with chai. So they're still taking carbohydrates, but they think I've stopped sugar or I've stopped mango. But the diabetes never got cured because they're still taking hidden carbohydrates, which they don't even realize. They might be all home food, but if you're still eating carbohydrates, it's not going to go away. All right. Sleep management, stress management, exercise, and then intermittent fasting in certain patients has helped to reverse diabetes and get them to less medication. Okay. So the way I describe it is, if you're going to take a car on the highway, Bombay to Goa, on a long drive, you need to first get the car checked in the garage for a tune-up. 4 wheels have to be correct. Even one puncture and you cannot drive. Doesn't matter if the other 3 wheels are correct. You need all 4 wheels in proper condition. Nutrition, sleep, stress, exercise. After that, you can talk about intermittent fasting. We do it with medication management as well, because being a medical doctor, I need to manage your medication to make it safe for you to fast. Because you may think, somebody with diabetes, how can they fast? They have to eat every 2 hours. Why should they eat every 2 hours? If you met someone like us and we prescribed you such heavy medicines that your sugar is now going to drop, only then you have to keep eating. Remember, if the diagnosis of diabetes was coming with a growing waistline, increasing weight, how can the solution be to make you keep eating? And then we tell you that you should lose weight in diabetes. How will you lose weight if you keep eating? I've not seen anybody who's able to do that for the rest of their life. Okay. And managing stress through spirituality. And one of my patients gave me an analogy. She said, Doc, you know what you've taught me? You've taught me to drive my own car nutrition, sleep, stress, exercise, fasting. And you've also taught me that the fuel for this car, the petrol or diesel for this car, is self love and self care. And I thought that was beautiful. And that's exactly right. We don't want to make you run this on fear. Fear is not a way to sustain changes for the rest of your life. If I have a smoker and I keep saying you'll get cancer, you'll get cancer, that doesn't work. Making somebody scared does not work to quit smoking. Why will they quit? When they decide that they love themselves enough. Why will someone make the changes in lifestyle for diabetes or for any hormone management for the rest of their life if the fuel is self care? And this is the American Diabetes Association guidelines 2020. So I like to also keep you guys up to date that in medical nutrition therapy, in fine print, it is written very clearly that going low carb or very low carb helps reduce diabetes medication. It's just that people don't tell you this. And people don't know what are the Indian carbohydrates. We live in a country where vegetarianism is very common. Even people who say they are non-veg are eating small pieces of non-veg maybe twice a week, but they're not eating it every day. So they're also practically eating all the time veg, which is fine. I don't have a problem. I'm veg myself. But if they're going heavy on the carbohydrates, they're getting stuck. So what we have as goals for you or for anybody who works with us is how to get your sugar under control, HbA1c, sugar levels, no low sugar problems. Everything should be stable. Less medicine for sugar, triglyceride, cholesterol. De-prescribe insulin if it's type 2. How will you know? Check the fasting C-peptide. Less insulin dose. These people are feeling energy levels going up, mood going up, positivity going up. They don't feel stuck in some diet, ki mera wo chhoot gaya, my favorite food is gone, none of that. And so many allied symptoms, body pain, shoulder pain, acidity, headache, insomnia, everything getting better with less medication. So I just want to leave you with the fact that type 2 diabetes can be reversed. Think of it as not just a blood sugar problem, think of it as an insulin problem. If there's one thing you can remember today, think about it that if you make lifestyle changes to reduce insulin resistance, that's your way out. Okay. So whatever treatment is given to you, check whether that is reducing insulin resistance or keeping you stuck in insulin resistance. If you're eating every 2 hours, you will not get out of insulin resistance.